Hello, everyone. Thank you very much for joining us tonight. We are around for our V.A.C. Roundtable number 45. We're having a discussion with Dr. Dhanabalan, who is going to give us an education about cannabis as we continue to have discussions with people who inspire us in the Veterans Action Council. So thank you very much, everybody, for joining us tonight. And we're going to start off with just a brief introduction. Dr. Dhanabalan is a highly respected physician trained in family medicine and occupational environmental medicine from Harvard Medical School. She is a fellow with the American Academy of Family Physicians and a Diplomat Certified in Cannabinoid Medicine. Dr. Dhanabalan is a founder and CEO of Global Health and Hygiene Solutions, LLC, whose mission is to promote wellness and prevent illness in the global and private sectors. She currently practices at Uplifting Health and Wellness in Cambridge, Massachusetts. She is dedicated to educating, embracing, and empowering her patients while promoting cannabinoid medicine as a treatment option. Dr. Dhanabalan believes that cannabis is an entrance to a better quality of life, an exit drug from pharmaceuticals, narcotics, alcohols, and nicotine. So again, thank you for joining us tonight. So we're basically going to get right into our discussion. So Dr. Dhanabalan, please explain how cannabis works as an exit drug more than a gateway drug, because as we have been educated through the misinformation through our educational systems, we've been led to believe all along that this is an actual gateway drug. So could you explain why this is not the fact?
Well, first of all, I want to say thank you to everybody that's here with us and everybody out there all throughout the world for joining us today. And I truly believe in the concept of, if anything, it's a gateway to a better quality of life, and it's an exit drug. And the reason I explain it that way is because it has helped people to eliminate, and I use that word eliminate, as completely be able to remove opioids, alcohol, and nicotine and other pharmaceutical drugs, and definitely reduce many of their medications, and it gives them a better quality of life. And this is something that most patients don't have the option to be able to include cannabis as a tool in their medication repertoire, and it really depends on the state that they're in.
Thank you very much. Next up, it will be Councilmember Wade Laughter with our next question.
Yes, thank you, Dr. Dhanabalan, for joining us this afternoon. I'm grateful that you have, you're kind of leading the way, if you will, in cannabinoid science here in America, and I'm grateful for that. What do you think about the phrase PTS growth? And will you say something about that? Thank you.
Absolutely. You know, I like to deter away from PTSD because I feel like that D puts everybody as a disease, a disorder, you know, something to code people by. And I really feel that it should be just called post-traumatic stress. And growth is a wonderful way of looking at it as a very positive thing. And we all go through stress at some point in our life, and how we cope with it and use it as a positive way, I think is very helpful. And I think the ability that we can share that how people have dealt with their stress and how they've grown from it, I love that concept versus a negative aspect from it. Thank you.
And to follow up, one of our first roundtables was on post-traumatic growth, because that is something that we have been looking for and toward, because each one of us that tends to be on our council outright has been working actively to affect change and move the needle forward. So PTS growth is something that we find very helpful in discussing with a lot of especially entry patients and people who are new into the activism, because we want them to have examples of how we've overcome our traumas, as well as how we have moved past that, in finding help in the service of others has helped a great deal of us veterans who continue to struggle with our post-traumatic stress. It helps us heal and move forward by giving us purpose and helping and working directly with people. So thank you for your insights on that. And did you want to follow up on anything regarding that, Dr. Dhanabalan?
Absolutely. I really feel that right now the whole world is suffering with PTS, especially with COVID being something that we've all been impacted by in some way, shape, or form. It's touched us and it's impacted us. And so, and I really feel that through this, some people have absolutely taken it as an opportunity to grow. And it's change. And with change comes some difficulties. And we definitely should look at it as an opportunity of growth. And I love the fact that the veterans have each other to support and grow from it.
Thank you. It's one of the things that we found that we had to do ourselves, because we found that the VA, of course, was not doing its job, or the job that we felt it should. We started this organization, as basically a group of volunteers to kind of check out on each other regarding suicide watch. So we kind of started as a buddy check to make sure that everybody was doing okay during COVID. And we grew from that and continue to work at the local, national, and international levels. So this is one way that we use ourselves as examples to keep everybody moving forward and walking forward together. Next up will be Council Member Nate Landau with our next question.
Thank you so much for being here. My question is, how do you see us taking the best advantage of cannabis for national mainstream marketplace?
I think the opportunity is that I boldly use this word, mandate. We should be mandating all healthcare providers, especially in the states where we have a medical program, that they must learn that we have an endocannabinoid system. And the Veterans Administration must make this as part of their mandate. And I have no problem saying that. We're mandated to learn about opioids. We're mandated to learn about all the up-to-date vaccines and precautions that we have to take. Why have we not made this as a part of a rule for all healthcare providers across the state? We've recognized it as a medicine. We've recognized it state by state. We're making rules saying that this is a medical cannabis program. And I really want to call it that. They should be calling it a medical cannabis program, not a medical marijuana program, because I think marijuana, again, still has that stigma and negative connotations. And so I really feel very strongly that this is where we can kind of, by using the word cannabis and making it part of the mainstream, we're going to have people awaken maybe a little bit to start to say, hey, it is a plant, and it's a plant that's been around for thousands of years. And this was able to be prescribed by healthcare providers. And because of politics and racism, not because of evidence-based medicine, did this get into being a illegal Schedule I drug today, not based on evidence-based medicine at all. And I want that to be part of understood by mainstream. And we have that opportunity now, especially since veterans are not just isolated in the states that have cannabis. They're in every state. And if they're not just here locally, they're here globally. So I think that this is an opportunity that we do have, because cannabis is a global issue. And I've been saying this for years now. And so we have the opportunity to, correct the wrongdoings in one way, because United States of America did lead into part of this being into prohibition. So we have an opportunity to correct the wrongdoing now and to move forward.
You had a follow-up, Nate?
Yeah. Do you mind elaborating on the endocannabinoid system a little bit? From what I understand, it was discovered in the 80s or 90s. It's one of the last systems that we discovered. And how complicated is it to change a medical school curriculum? If you mind elaborating on that.
I think I'll start with the last part and kind of move backwards. I think changing medical school curriculum is difficult since we keep saying that there's so much material we have to learn, you know, and it keeps but yet we are updated on medications. You know, we have somebody that brings in and says, this is what you have to learn about this thing right now. There's an opportunity that a doctor can learn that we have an endocannabinoid system. That first must be taught. Okay, that acknowledgement was not even given to me. And I went through not just one residency, I went through multiple residencies and multiple years of education, and nowhere along that way had I learned that there was an endocannabinoid system. It was in 2010 that I started to learn on my own. And so what I want people to understand is that yes, we found out that our body makes endocannabinoids much later. But what we do know is that this system today, at least, forget about what we didn't know. Today, 2022, we know that this system is there. So why not start by saying, here's a brief 15-minute info commercial that every healthcare provider must learn that you have an endocannabinoid system. And I would be happy to explain it to them very simply. Just like we have digestive system, a cardiac system, a respiratory system, reproductive system, there's an endocannabinoid system. And it is very similar and analogous to the nervous system. And we understand that there's a presynaptic and a postsynaptic, and neurotransmitters like dopamine and serotonin are made in the presynaptic, they're released, and they bind to the postsynaptic. What's unique is that we have endo, meaning within our body, cannabinoids that mimic cannabinoids that are in the lovely plant cannabis, and they're produced in the postsynaptic, and they're released and they bind to the presynaptic. So it's a retrograde mechanism. So my analogy is that a pitcher has the ball, he throws the ball, the catcher catches it, that's a nervous system. With the endocannabinoid system, the catcher is making the endocannabinoids, he's got the ball and he's throwing it and the pitcher is catching it. And between these two, they have, their function is to keep us at ease. And if we are not at ease, we are at dis-ease. And that's how I explain the endocannabinoid system. Its function is to keep us at balance. Homeostasis is what we're looking at. And what's beautiful is that everybody's homeostasis, by the grace of God, is not the same every day. It may be more, it may be less. And this is why what one requires one day may be different than what one requires another day. And what we also understand is that most drugs we learn are on a bell curve. And what that means is drugs are made and dosed for 80% of the population. They don't care about the people where that dose is not enough or that dose is too much. As long as we treat 80% of the population, we're good to go with most prescribed medications. And that is why many of them are deadly and toxic and can be overdosed, okay? Now, with cannabis and the endocannabinoid system, I like to describe it, and I make it easy for people to remember. Remember Dr. Uma, it starts with a U, and the cannabinoid system is more like a U curve. Too little, too much. So what we're learning is that when this system is deficient, like Dr. Ethan Russo has explained, migraines, IBS, lupus, all of these different illnesses, fibromyalgia, are related to a dysfunction where the endocannabinoid system is deficient. There's also where the endocannabinoid system can be overactive. and that's in addiction, obesity. We're finding out that this is what's really beautiful about the endocannabinoid system and why people can find a sweet spot. Initially, there might be more that they need, but once they acclimate to it, there's a way for them to balance and be able to flow. And that's how I try to explain the endocannabinoid system. And that there's receptors. The first one that was identified was CB1, which is primarily in the brain, CB2, which is primarily in the immune system, but these receptors are throughout the whole body. And that's why this one plant with all its different facets is working for a panacea of diseases, but it is not a panacea treatment. But that's why it's able to work for so many different illnesses. And what we understand is that nobody, a big fat nobody, has ever died from a toxicity, because part of the brainstem that controls our breathing and our heart rate cannot be blocked by cannabinoids. And we say it funny that you may feel like you're dying if you take too much, but you're not going to die. So that's the safety part about cannabis. But truly, we have to understand that this system is there. It's millions of years old. It's evolved from a sea squirt to what we have in humans today, but it is real and it's a science. That must be taught to everybody in the whole world. That's my mission.
Well, that's quite a mission. I know Council Member Wade Laughter has a follow-up as we talk about single cell versus more complicated things such as the plant itself. Go ahead, Council Member Laughter.
Dr. Dhanabalan, that was a beautiful description of the endocannabinoid system. I've been learning about it. Of course, I never went to medical school, but I've been really fascinated by the science since around 2010 because of my work in cannabis. Anyway, as a clinician or a medical practitioner, you, as you said, you spent years learning about prescription drugs that can kill people. And especially when you start piling one on top of another, on top of another, on top of another, where you end up treating the symptoms or adverse side effects of the first medication, it can be disastrous, as you know. But meanwhile, you know, as veterans, even within the VHA, we have trouble getting access to good medicines and guidance on how to use them. And what's true is in medicine today, you can get, you know, THC in the hospital called Marinol if your doctor prescribes it. And now there's Epidiolex and Sativex and for different conditions. But like you said, that model of hitting 80%, how does that translate into practice in a hospital or even in a family practice where you're working with individual patients? Could you talk about that, please?
Absolutely. So I'm very fortunate. You know, when I decided to get bold and speak about cannabis, I left the system. I don't work for the hospitals. I don't work for the universities. I don't work for insurance companies. I left that and I love what I do. I truly am blessed because I am able to offer, I can write those prescriptions. I choose not to write opioids, and I haven't written an opioid in over 15 years, but I have written recommendations for cannabinoids since 2012. And what I feel is that I've been able to truly get to practice family medicine because I usually end up with one family member, and now throughout the years, I'll get another family member. The child might come in, the parent will come in later, or the parent comes in and now the child, and then, you know, their parents. So I even have 4 generations now that I get to practice: the child, the mother, the grandmother, and the great grandmother. And it's really beautiful because I feel very sorry for my colleagues. You know, just like we're losing veterans today, we're losing healthcare providers. I don't know if you guys have heard the statistics that we're losing almost a doctor a day right now to suicide. And it's alarming because doctors, I feel, have lost their autonomy. They're also unhappy. You know, they're now told to practice medicine by somebody else that doesn't really understand medicine, that wasn't a doctor, it's somebody that's a number cruncher. And what I feel is, in the last 10 years, I can truly say that I've helped people improve their quality of life and impact their families. And what they've also done is actually go back to the community and teach some of my healthcare providers, like, no, I don't need that prescription filled anymore. And no, I don't want that higher dose. And yes, I can use an edible instead of that tramadol, or I can slowly, Dr. Uma has taught me that I can have a plan to exit, my exit plan on how to slowly get them tapered off their prescription medications. And I practice cannabinoid medicine by following them up. I don't just give a 1-year certificate, and I take that part of my business very, very seriously. And I tell that to everybody out there, these people that are doling out veterans for 1-year cards and no follow-up, that's just wrong. That's just wrong. I tell that to doctors, you would never give somebody a blood pressure medicine or a diabetic medicine or whatever medicine and say, see you in a year. We would never do that. Why would you do that with cannabis? Why would you do that with giving them a recommendation for a medicine that they're maybe, even if they've been on it before, why wouldn't you want to see how it's impacting them? And why wouldn't you want to monitor them? So I don't know if that answered the question, but that's what I want healthcare providers to understand, that they don't have to write the recommendations. Understand that there's this alternative. At least if you're in a state that there's a medical cannabis program, you must be mandated to understand that cannabinoid medicine is available and it should be covered for all veterans. I really believe that strongly. If we're gonna have a state mandate, why can't the veterans get a hold of this and be covered and not have to be on a lethal medicine and a much safer alternative? And why should your zip code mandate that availability?
Exactly. Great points. Nate Landau.
I know that there's not a lot of research besides like GW Pharmaceutical. It's been 20 years developing a particular thing. And I'm really glad that you don't just write the recommendation and send them on their way. Have you developed any methodologies or anything, like you were mentioning migraines and different stuff like that, on how, with the limited research that we have, how you can build these methodologies with the different clients? And I know everyone's different.
Absolutely. And this is where I tell people, look, by the grace of God, cannabis medicine is truly personalized medicine. Okay, where the individual has an authority over their own body. Okay, and this is what I want people to know. It's your body, it's your life. Get educated. You must become an educated consumer, become an educated customer. Because if you're willing to be on a medication without a plan to ever get off of it, say, can we look at other options? And especially when we started out by saying the side effects are what we have to treat again. I used to call it the party pack of 5: blood pressure, diabetes, something for cholesterol, something for reflux, and something for anxiety or depression. I did this prescriptions day in and day out, and there was no exit plan. It was just treat another symptom, add another pill. So I really feel that the individuals must get involved in their own bodies. You must start to look at the labels. You must understand what you're taking your medicines. What dose are you taking? What is the purpose of it? Are you taking more than one medicine for the same thing? Can you make some lifestyle changes? Because your doctor definitely doesn't have the time to talk about it anymore.
No, that's a real point. On top of that, we deal with the rotating physicians in the VA system, which on average is 3 years. So, you know, we're lucky to have even continuity of doctors in the VA system. And as we know, for me, it's usually an education program to just bring them up to speed outright, because as you know, they're not actually taught this anymore or whereas it should be in absolutely every basic doctor's entrance exam, an understanding of the endocannabinoid system. Councilmember Alburn, do you have a follow-up?
I do. Hey, Uma, thank you so much for.
Hugs.
It's great to see you, man.
Same here.
It's great to see you. I'm going to ask you a question that's really going to get exciting because I know the answer. So listen, Dr. Uma, what do you think about these lawyers and cops telling you how to practice medicine? What do you think about that?
I'm going to take a deep breath because, you know, I've been involved as a physician much longer than I've been involved with cannabis or cannabinoid medicine. So I really feel that my colleagues are also struggling. I certify doctors, and you know, they're fearful of the fact that the board might find out that they use cannabis as medicine. You know, they're fearful of it. And so I feel very fortunate that I don't have to worry about how much time I spend with the patient. If I want to spend 45 minutes or an hour and a half, I get the liberty to spend with that. And doctors right now are struggling. You know, they're struggling because they're seeing 20, 40 patients a day. How do you get to have continuity of care, like you said? And right now, there's not enough doctors, there's not enough caregivers, there's not enough providers. I've been involved with this whole system, not only as a patient, but as a caregiver and as a healthcare provider. And what I really keep coming back to is the fact that each one of us now has the opportunity. There's Google, there's PubMed, there's information that you can get to find out about and look into it. And that's what I think is happening to the whole medical system right now, is that doctors also realize that they're prescribing these medications. And we're very fortunate with the technology that we have, you know, amazing technology that we're advancing. But I feel that the art of medicine has been lost. And I went into this to be a doctor, to take care of families, to make a difference. And I can truly say I feel that today. And I feel that with my patients. I don't know if I can say that for all of my colleagues, though. So I don't know if that answers the question. And the other part about it is that there's still a discrimination. There's still a stigmatization because they keep giving the same daggone rhetoric. We don't have the research. We don't. Well, yes, we do. Yes, we do. Look it up. You know, stop saying this rhetoric about the developing brain. The brain is developing till the day we die, folks. So to say that there's a cutoff, that's bull crapola. And we know neuroplasticity can happen. We know change is happening. We know cells can grow. We know that people can change. And one of the philosophies I truly believe is reach one, teach 10. So whatever knowledge that we know, please share it. Please translate it for other people and enlighten them.
And that's what we're trying to do here.
Absolutely.
Go ahead, Dan.
I just wanted to say, I make this quote and I say, you know, all patients are not healthcare providers, yet all healthcare providers are patients. And don't we ever forget that.
Councilmember Laughter, you had a follow-up?
Yes. Again, thank you, Doctor. This is a great conversation. I believe, I'm not sure that this is the case, and Etienne, you could correct me, or Nate, you might know, but in California, physicians are prohibited from having a cannabis recommendation. I assume as adult users, now that we have recreational or adult use, doctors can consume cannabis legally. But I know at one point, the California Medical Board, I sat in on one of their meetings and they were discussing, I was there because they were discussing cannabis and where would it fall in a treatment protocol. And all these doctors ended up deciding it was the measure of last resort. for all conditions. And I was stunned, and I realized that a lot what you were saying earlier. I probably knew more about the endocannabinoid system than any of those doctors sitting up there. How could they end up with that kind of conclusion? But again, I didn't go to medical school, so they didn't want to hear from me. But I had a question for you. I love your passion. I love that you're trying to change the medical profession. One of the things that as an activist and a patient myself, that I find most challenging about legalization is cost. And to be blunt, in many places, poor quality of the cannabis and cannabis products that are available. I know it's not your area of expertise, but you probably have some part of your heart that really wants it to be different that way. What would that look like for you? How could we fix the high cost of legal cannabis, even in California, and in states where it's not available? Your thoughts or opinions. Thank you.
Thank you for the question. You know, I really believe that my roots come from being a farmer. My grandparents were farmers, and I really believe that there's so many beautiful farmers out there, and we need to tap into them and let people grow this plant, whoever can grow it properly. And I'm originally from India, and plants are considered as deities, and cannabis was considered as a sacred plant, and it's still a sacred plant along with many other plants. And so this is where I believe that there's so much we don't know, but what we do know is that if we can have more people grow it that can do it well and make it a joy for them. And I just actually, believe it or not, I had to do a testification earlier today in Rhode Island for two people that as a church, they were trying to grow cannabis and they were arrested for their consumption. But this is what measures people are taking now to try to do this growing of a plant, to grow it safely and to make sure it's safe, because one of my backgrounds is in heavy metals. So I've said, this plant's not, that has killed nobody, don't mess with my plant. Because if they grow it improperly, or if they grow it in soil that is contaminated with heavy metals and not properly processed, they can create a poison out of this plant. And then we are making it into, we're condensing it, we're processing it, and we're concentrating it. So when there was a small amount, now that you concentrate it, you can make it much more impactful, and it could be very detrimental. So what I would love to see is that people that do have an interest come up and step up to the table. People that have the land step up to the table. People that want to understand what it's involved, outdoor grows. Because right now, because of the legality of it, most large dispensaries are growing it indoor to control it, which means that they have to use more pesticides and solvents. And once the plant is contaminated and then you try to change it, the plant is still contaminated. Just because you're processing it doesn't mean it wasn't contaminated with mold. And they forget about these things. So there's a lot of standards, and it's truly about education that still has to happen. And what I believe is that the farmers and the people, the legacy people that have been growing this, must be allowed to step up to the table and be honored to show what they've learned so that others can learn from it. Teach it to others. My mother always said, learn it, do it, teach it. Learn it, do it, teach it. So why don't we let the people that know how to do it, teach it to others or do it? And I think for veterans, I think the opportunity, be able to grow even one plant and to take care of one plant would be very healing. From the point of growing the seed to watching it day by day. I remember one of the projects that was still memorable in my younger years was growing a lima bean. We had to sprout it and watch it grow. And so I think there's a lot to being able to farm this plant would be beautiful, but to do it properly.
Absolutely. Next up is Council Member Tony Landry with our next question.
Hi, Dr. Uma.
Hi, Tony. How are you?
Oh, it was great meeting you at the Patients Out of Time conference up in Kansas City in what was that, June, I think. And it was great meeting you. And it's an honor to be here again with you in the
Thank
meeting tonight. And my question is, you mentioned about the training and yeah, I totally agree with that. And that's part of the reason why there's so much stigma. And I was wondering if you've ever, because of your activism in cannabis, have you ever experienced any negative career repercussions for that?
You know, I've been ridiculed, and I think I've gotten a little taller because, you know, when you walk into a room, and I get a little emotional now because I still remember coming back to Massachusetts from Washington in 2014 and coming into the Mass Medical Society and thinking that my colleagues would embrace me because I knew this knowledge, and they would giggle and ridicule me. And, you know, being called a pot doctor, now I don't care. Call me whatever you want, you know. I don't care what you call me, because I am able to stand up, and I know I'm doing the right thing, and I've been doing the right thing, and I'm giving people an option. So hooey on anybody that wants to talk ill about me or anything else. But at the end of the day, I feel that all of us, I don't care who you are, where you are, is going to die. And what I really believe in is palliative care and cannabis as a first line option for these patients. You know, I always say cannabis is not for everybody, yet it should be a first line option and not the last resort. So if my colleagues can at least say, look, the people that you've thrown the hands up when say, I got nothing for you, please send them my way. Please say, look, at least let's let you die with dignity. Let's give you this as an option for not just the patient, I say this, but for their caregivers, for the people that love them, to be able to know that you let them die with dignity, I think is very, very important. So I feel my colleagues, if they don't want to see anything else, I feel this is a humanitarian issue, and it should be a global humanitarian issue, that we be able to let people have this as an option. And I still face it. I still face the ridiculism. I still face the discrimination. I can't get a loan because they say you're a cannabis advocate. I said, I'm a medical doctor. I'm a medical doctor. I don't touch the plant. I don't sell CBD. I don't sell hemp. I don't sell marijuana. I have nothing. I write recommendations, and yet I'm discriminated by it. And I want everybody out there to understand that is just not acceptable. Why should I be discriminated because I'm writing a recommendation for a plant that's legally available? And I'm not a cannabis anything. I am a cannabinoid medicine specialist, and I'm proud of it. And I'm a diplomat, and I was certified by the American Academy of Cannabinoid Medicine in the year 2014.
No, I'm sorry to hear that. You know, it's still a reality. I own and operate the oldest cannabis dispensary in the United States, and we've been kicked out of 38 different banks. So I share your frustration, but in no way, shape, or form, I actually touch the plant. I actually provide the medical cannabis. So that a doctor is actually discriminated against or harassed in any way, shape, or form, especially by a financial institution, especially not touching the plant in any way, shape, or form, and just by educating and writing recommendations is beyond ludicrous. And you would think this would be 1922 and not 2022, the way that we are treated. But unfortunately, that's just the reality that we're faced with. So thank you for your continued perseverance, Doctor. It is to be applauded, as well as I hope someday that your profession will celebrate and allow your humor amongst about this situation that, of course, is beyond tiring and frustration. So
It's
with that, we're
changing,
gonna.
though. It is
Yes.
changing. I have to say that, you know, people are understanding it. The banking industry is slowly, there's people being creative, you know, with every problem. I look at it as an opportunity. So, you know, I got involved in this because I lost my mom. So I too understand PTS very clearly. And it is frustrating, But I believe, like, if my mom had not died and it didn't impact me, I would not have this passion or the ability to speak so boldly. So, make a lemonade out of lemons, I guess, at times.
Absolutely. And one of my monikers is Chief Lemonade Maker. You get so used to the lemons, you might as well just bring out your own sugar with it and make your own lemonade, right? All right. Well, next up is with our final question will be our one of our newer members, Dale Seidlitz. Please go ahead with our question.
Hi, Dr. Emma. I was actually at my GP visit today with the VA, and everything you've described fit my experience perfectly. It's my newest GP, and she asked me who prescribed this medicine and how long has it been since you've seen that person. And it's been a year, it's been 2 years, it's been this and that. And why haven't they followed up with you? Well, how the hell do I know? I've tried to follow up and this and that. So very, very interesting. Loved everything you've said thus far. But I'm going to segue from that experience I had today, because you hit that nail on the head, or staying with the baseball theme, you knocked it out of the park. What do you see as our role as patients as medical cannabis enters the mainstream, as we start seeing it more and more come into the mainstream in the different states in the United States and so on? What is our role? What do we need to do and be prepared for?
I use the word conscious use. I use that, and I'll repeat that again, conscious use, because anything can be misused, abused, overused, which can lead to addiction. Okay. And so what we have to understand is that we must continue the education on understanding appropriate use. We don't want to harm anybody. I took an oath that said do no harm, but I take it one further and say, Dr. Uma says safety first, do no harm. So that's where I think the opportunity is, that we understand what the underlying issues are, what are the mental issues, because cannabis is not the treatment for everything. We have to understand how is cannabis being used, people that are self-medicating, and the terminologies that we're using. I think these are the things that we have the opportunity. When we talk about cannabis as being medical and recreational, I think that is so wrong. That is just so wrong, because we would never talk about your cardiac system working medically and recreationally. We don't say your pulmonary system is working medically and recreationally, and here's your inhaler for your medical use, and here's your inhaler for your recreational use. If you have a condition, it's a condition, right? So I think what we need to make people understand is that cannabis is being used for some type of purpose if it's self-medicating. And the way I hope to see it is that the way I see ibuprofen or these medications, how they've evolved. If, for example, you have a trauma and you have an injury and they say, take an anti-inflammatory, you could go over the counter and buy ibuprofen at any store, pretty much. And you could get a store brand or just basic ibuprofen, or Advil, or the trademark brands. If you want a stronger dose, you need a doctor to write a prescription for you to get a 600 or an 800 milligram. So this is where I see things may be changing, where we'll be able to get smaller dose things over the counter, larger dose things requiring more with a doctor's prescription. What I also see is that I hope to see it descheduled. It doesn't belong on any schedule. That's where it belongs. It doesn't belong on any schedule, but we still have to understand that this is still a drug. Food is a drug to me. If we don't know what our food sources are and what's in it and how much we consume and how it impacts us, we're not being educated and using things consciously. So this is where I feel the opportunity is, because it is so available abundantly, that we should hold a higher standard, start to teach people to know what to look for, what are the standards, because I do believe testing should be there so we know what's in the product, because we're giving it to babies, we're giving it to people that are immunocompromised. So we need to make sure that we're giving safe products. Does that answer your question?
Yeah, I was just gonna, you hit the one term, and I think education is key. And I think the education of medical cannabis is really the key for everyone. And I don't know if there's been enough education around it. And so maybe that's really what we can focus on, what we can help with, and what we can drive to help the movement even better. I don't know your feelings on that, but I look at everything as just educating better and trying to. I mean, life is education, right? It's getting smarter, getting better. That's kind of how I look at it. So I think with this subject and with what we're doing here, that's what we need to do as we move forward.
I just want people to also remember, we've been like brainwashed with this thing, evidence-based medicine. Okay, that was imprinted in my brain cell, right? Evidence-based medicine. Well, evidence-based medicine is what got these opioids to the market too, folks. So I want people to understand, become an educated customer. I think I've said that repeatedly tonight. Understand who's doing the research, who's behind, what is their agenda, what is your agenda and your body's health. And the more we learn, the more research and the more cannabinoid research we do, we're going to learn more and more. And cannabis has been around for thousands of years. It was used as medicine for many things, and it was also used for the treatment of opioid addiction. It was used for the treatment of alcoholism. It was used for the treatment of insanity. It didn't cause these things, as we started this conversation saying the gateway drug. So if anything, I believe it's a gateway to a better quality of life. And it is truly an exit drug, and it can be an exit protocol that doctors can learn about and use it as an adjunct therapy with their other medications, is the other thing I want people to know.
Excellent. Council member Michael Krowitz, you had a follow-up.
Actually, I just had a kind of a new question I just wanted to ask. And it's great to see Dr. Uma. In the historical antiques and collectibles world that I've been working in for a long time on this museum project, I've run into a bunch of artifacts about medicinal cannabis seeds. And I know that Japan has a history of medicinal cannabis seeds. And I just put a photo of the most recent artifact. I just found a German version of the apothecary drawer pull for the cannabis hemp seeds. So I just wondered if you could break down or if you have any experience with what exactly with the hemp seeds is medicinal and how did they use that?
The first thing that popped into my head was an image of Buddha and how he lived on 1 grain of a hemp seed is what the story goes back to. And so this is one of my theories. I truly believe that hemp was part of our innate need, because how could we have where we're producing a cannabinoid that mimics THC? How could that be unless it was part of our innate need? And I believe that because cannabis was removed from our society, from the animals, this is why we have so many of the diseases and the autoimmune illnesses. I truly believe that if we start looking at the seeds and the genetics of the seeds, and we start looking at the genetics of the people and the diseases, I really believe, mark my words on that we're going to see that there was a deficiency or an overactivity, that U curve again, too much, too little. What happened in your genes is probably what's impacting us. And I really believe that, again, hemp, 1 serving of hemp is 3 tablespoons, gives 10 grams of protein, easily digestible, 12 grams of omega-3, omega-6, 20 amino acids. 9 of them are essential. So we know that anybody out there, even if they don't want to inhale cannabis or ingest it in different ways, they can start with hemp and incorporate this food as dietary. If our animals, our produce was fed hemp, they would not be inflamed. The animals, then when we consume it, we would not be inflamed. So this is where one of the things I've said is that this plant is for the 5 Ps, that this plant is for people. It's for pets or produce. It's for our planet. If we planted this plant, what it could do to our whole earth with the climate change. It's for peace. If we legalize this plant and people did not have to face jail sentences that they're still facing today for a plant, there would be peace on earth and profit. And when I mean profit, I mean one's health and wellness. No amount of money can give you your health and wellness, and also all the jobs that we can create. So I believe in the seeds. The more we learn about the seeds and we look at the genetics, I believe the answers are there, and we will find the genetic makeup for what we are deficient in. Just my thoughts.
No, that is excellent. We're going to kind of go in a different direction. One of our mothers, who's a veteran, who is here, Saya Gonzalez, has a question that is very apt given the political climate that we're in right now. Go ahead, Asaya.
Thank you. Good evening, everyone. Thank you for having me. Thank you for your time, Dr. Uma.
Thank you.
I apologize for my kid's foot. I am personally curious, well, actually on topic, we purchase hemp protein from Sprouts, and to my understanding, that protein is a byproduct of them squeezing the seeds for oil, and then they take that meal and they grind it up, and that's the protein. We also regularly purchase cold hemp hearts and add them to smoothies. So it's really nice to hear everything that you just explained about as far as like consumption, because that is something that like I'm grateful to be able to offer something to my kids that isn't psychoactive, but is still beneficial of the plant for them. I've gotten to know a group of ladies up in Humboldt. They call themselves Moms Do Weed. There's actually quite a few mom groups out there. But for me personally, I was administratively separated from the Marine Corps because I chose to use, cannabis on active duty while I was postpartum, specifically to treat the depression, to be able to get up and do dishes and whatnot. And I'd taken antidepressants through my pregnancy because the way it was explained to me was that if an athlete gets hurt, they're going to take the pain medication to be able to get through physical therapy. And that's essentially how it was put to me in terms of getting through my service, which was, in hindsight, looking back, personally, I feel cannabis is more beneficial and able to be used in moderation. So I'm curious about your perspective on maternal cannabis use, say, through pregnancy, breastfeeding, and postpartum.
I'm so glad. Thank you for your service and being a mom, which is amazing. And as far as my practice and my thoughts, I just recently had a case, and I just spoke to Melanie Dreyer, and Dr. Melanie Dreyer had done one of the first research studies in Jamaica looking at the Rastafarian population and followed them over time. And in the Rasta community, cannabis is part of their culture, and it's used throughout their pregnancy, feeding, after. And we know that the babies that have been followed through, hi sweetheart, are socially and emotionally engaged, and we don't see all of these things that we've been told. And I will tell you, in my practice, I take care of babies, and I'm very proud. I can say that some of my patients that were told that they would never get pregnant, would never have children, I really truly believe that cannabinoid medicine helped them to conceive and help them to be able to be a parent today. And what we do know is that these endocannabinoids are throughout the body, and we know that these are also the first drop of breast milk a baby receives has this molecule known as anandamide, which mimics THC and works with the receptors. That's why THC works, because it mimics it. And so, when they say baby milk drunk, I say happy baby. The baby is the mantra of what Dr. Damaso says: relax, eat, sleep, forget, and protect. So that's is what the baby is doing. It's able to nourish itself. It's able to build up that immunity because the baby has the mom's immunity for the first 6 months. And through this, it's gaining its own immunity. It's able to recover. It's able to forget that it's gone through this canal and everything that it's been through, and now in this outer world. And there's so much sadness of our babies being taken away from our mothers because they tested positive for THC. That's insanity, because they'll rather them be tested positive for their ambience and their other SSRIs. That's okay. And we don't know the impact of that 20 years, 30 years, 40 years from now, but we do know that cannabis has not harmed them, but we will not give this, but we will take our babies away from our mamas. That to me is wrong and unacceptable. So
were reported twice to Child Protective Services because my command was aware that I was breastfeeding. No one wanted to ask questions around over the precautionary measures that I was taking, but the social worker who wound up assigned to us, we wound up having a nurse practitioner who would regularly come into our home and evaluate us. And I feel that that was an amazing resource that we should have had available to us without that that negative filing report having to go through. And she went out of her way to try and get into contact with my commanding officer to ask him to leave our family alone. It was unnecessary. So I wholeheartedly appreciate everything you just laid out. Thank you.
thank you. I mean, this is really, you know, some states now what's happening, and this is slowly, and I've been involved in this too, is that they're saying we're not going to test for THC. They're doing this across, even in the, I wanted to go back and say this with some of the doctors in the medical schools and the residency programs now, new onboarding of clinicians, they're taking that off their drug testing panel. And I feel that they should do the same with mothers. They should not be testing for THC, because the problem is, just because you test positive does not mean you're impaired. I want to go back to that as well. And I want to talk about that because I am a medical review officer, and I like to use the word intoxication, not psychoactive, because people can take CBD and feel at ease. So that to me is psychoactive. So just to say THC and CBD, I look at it as it's a spectrum of impairment versus non-impairment. And if you've not eaten, not slept, you're impaired, okay? If you've not had a good night's rest and you decide to get behind a vehicle, I'm sorry, you're not trustworthy, okay? If I've not had a good meal and I decide to drive, I'm not properly situated. So we have to look at this and not just look at a positive THC testing. And THC is fat soluble, so it stays in the body longer. If somebody did an 8 ball of cocaine tonight and they get a drug test on Monday, they'll be negative because it's washed out of their system. But if they smoked a joint or consumed cannabis, it could still be positive because it's still in their system. It doesn't mean they're impaired. It just means they're testing positive. So drug testing does not equate to impairment. And I want to get that message out too. And I'm going to go one step bolder. If you're going to start testing people and they test positive for THC, better start giving them a bonus, because they're saving the government and a lot of people a lot of money, and they're not the problem. It's the other issues that we really have to address. And that's a whole nother conversation.
Absolutely do appreciate your passion. Absolutely. Thank you very much for that. I think we have one follow-up from Nate Landau.
I just want to expand on something you mentioned earlier, that cannabis is a personalized medicine. I believe it's the University of Boulder and 2 other institutions are now mapping the genome of cannabis. I think they're 2 or 3 years away to having it fully mapped out. Do you see a future, because we already mapped the human genome, that we can have really personalized medication where you have some illness that can be explained, they take your DNA sample, and then they find the right strain to pair with you? Do you think, and I know it's going to take a while, but you see a future like that?
I do. And, you know, it's really interesting you mention this, because, you know, there's so much that we were saying that you can't change things. And this is where I feel like there's so much we don't understand. We know that we can change ourselves. Cells can be rejuvenated. And I really believe that by understanding, getting all of these cultivars, and we need to go back and find the land races and go back and save some of these land races, because I believe the answers are in finding the genetic makeup of these seeds like you're doing, Michael. I think that's just invaluable. Like wherever we can get these seeds from and be able to look at it, analyze it, and look at the people, look at the genetic diseases. I really believe there's something to it. I don't have all the answers, but I do believe the answers are there.
Thank you, everybody. All right. Well, this is going to wrap up our discussion for this evening, which was a discussion with Dr. Uma Dhanabalan. And I would like to thank our members tonight, Dale Seidlitz, Tony Landry, Wade Laughter, Al Byrne, Asaya Gonzalez, Nate Landau, and Michael Krawitz, and myself, Etienne Fontan. I want to thank you for a wonderful and lively discussion. Keep up the great work, Dr. Uma. We appreciate you, and we hope you come back in time and give us updates on how things are going. So is there anything, do you have a website or anything upcoming that you would like to plug, or any appearances coming? Please go ahead.
Absolutely. So I'm at 508-444-2324. I love what I'm doing. Our website is upliftinghealthandwellness.com, and my email is upliftinghealthandwellness@gmail.com. I will be in Atlanta, Georgia for the Veterans Day program that's going to be happening with Decatur. James Meisner is going to be posting that information. It's going to be an all-day event from 11 to 11. Food, giveaways, and just a lot of education that's going to be happening. And then I've been told that I'm receiving an award for Blood, Sweat, and Tears in Las Vegas. So I plan to be there. And that's going to be on the 15th of November. And then we'll keep you posted. But if there's anything that I could help with, please contact me and let me know how I can help.
Thank you, Dr. Uma, and thank you, everybody. This has been, again, V.A.C. Roundtable number 45, a discussion with Dr. Uma Dhanabalan. Thank you very much, everybody. Have a great rest of your night, and we'll talk to you soon.
Thank you, everybody. Good night. Stay well. Hugs.